Vitamin D is often called the sunshine vitamin, and for good reason. Our bodies are designed to make it whenever sunlight touches the skin. But as we age, something changes. We spend more time indoors. Our skin becomes thinner and less efficient at making vitamin D. And for many of us living in northern climates, sunlight in winter just isn't strong enough. The result? By age 60, many adults quietly slip into vitamin D deficiency without realizing it. In this episode, we'll explore why that matters and how a little sunshine, smart nutrition, and the right supplement can help you stay strong, mobile, and resilient. Vitamin D isn't just a vitamin. It's more like a hormone that affects nearly every organ in the body. Its most famous role is helping you absorb calcium, the mineral that keeps bones dense and unbreakable. Without enough vitamin D, calcium from your diet or supplements can't do its job. That's why low vitamin D levels are linked to osteoporosis and hip fractures in older adults. In fact, research shows that seniors with low vitamin D levels are 2 to 3 times more likely to fall or break a bone. But bones are only the beginning. Vitamin D also supports the immune system, helping your body recognize and destroy viruses and bacteria before they cause severe infection. During the COVID-19 pandemic, scientists around the world studied whether this vitamin could reduce the risk of severe illness. The answer wasn't simple, but one truth became clear: people with healthy vitamin D levels generally recovered faster and avoided intensive care. Vitamin D's influence extends to your muscles and even your mind. People with low vitamin D levels often describe fatigue, muscle weakness, or an unexplained heaviness, as if their bodies have lost their spark. The same nutrient affects mood. Low vitamin D has been linked to higher rates of depression, especially in the winter months when sunlight is scarce. When levels are restored, many people notice improved energy, strength, and emotional balance. So, if you want to stay active, upbeat, and independent after 60, keeping vitamin D in range is a decisive step. Here's the tricky part: vitamin D deficiency often hides in plain sight. You can't always tell from how you feel. Some people have perfectly normal energy until a minor fall reveals thinning bones. That's why testing matters. A simple blood test, called 25-hydroxyvitamin D, measures your body's vitamin D stores. Most experts recommend a range of 30 to 50 nanograms per milliliter, though your ideal level may vary depending on your health and medications. Once you know your level, you can tailor your plan, sunlight, food, or supplements, to get back on track. Sunlight is the most natural source of vitamin D, but you need to know how to use it safely. For fair to medium skin tones in summer, exposing your face, arms, and legs for about 10 to 15 minutes around noon can produce your daily vitamin D needs. Earlier or later in the day, when the sun is lower, you may need twice that time. If only your face and arms are exposed, you'll need even longer. But be careful, too much sun raises the risk of skin cancer, and sunscreen blocks vitamin D synthesis almost completely. The key is balance: brief, regular exposure without burning. In winter, or for those who live above 40 degrees latitude, sunlight alone isn't enough, and that's where diet and supplements step in. Vitamin D does exist in food, but usually in small amounts. Fatty fish such as salmon, mackerel, and sardines are the richest natural sources. 3 ounces gives 45 to 70% of daily needs. Egg yolks and fortified milk add a mild boost, a 4.6% of daily needs. To get 800 IU, the recommended daily intake for older adults, you'd need about 4 ounces of salmon every day or several servings of fortified dairy. That's hard to maintain, especially if your appetite or digestion has changed. So even with a balanced diet, most older adults still fall short. That's where supplementation makes sense. Vitamin D comes in 2 primary forms: D2, ergocalciferol, and D3, cholecalciferol. Your skin naturally produces D3, and research shows it's more effective at raising and maintaining blood levels. For most older adults, 1,000 to 2,000 IU of D3 per day works well. Those with severe deficiency might need higher doses for a short period under medical supervision. You'll find vitamin D in tablets, soft gels, gummies, and drops. It's often paired with calcium, magnesium, or vitamin K2, because these nutrients work as a team to build strong bones and prevent calcium from accumulating where it shouldn't. Vitamin K2 shuttles calcium into your bones and not your arteries. Vitamin D is remarkably safe when taken correctly. The tolerable upper limit for adults is about 4,000 IU per day. Toxicity is rare but can happen with excessive doses, leading to high calcium levels. Vitamin D is fat-soluble and is stored in the liver and fatty tissues. It doesn't wash out of the body so easily. Symptoms include nausea, weakness, or kidney problems. Certain conditions, such as sarcoidosis, lymphoma, or granulomatous diseases, affects vitamin D levels and lead to excessive calcium. Close medical monitoring is needed. And a few drugs, corticosteroids, weight loss medication orlistat, and anticonvulsants like phenytoin or phenobarbital, can interfere with vitamin D metabolism, lowering vitamin D levels. If you take these medications, talk with your healthcare provider before supplementing. Let's glance at some remarkable findings. In diabetes, vitamin D improved blood sugar control and reduced insulin resistance in dozens of trials, especially in people who were deficient to begin with. For respiratory infections, daily or weekly vitamin D lowered the risk of catching colds and flu by strengthening immune defenses. During COVID-19, patients given vitamin D were less likely to require intensive care or ventilation. And in long-term cancer studies, daily vitamin D3 use was linked to a 12% reduction in cancer deaths, particularly among adults 70 and older. These are not miracles, but they're meaningful. They tell us that vitamin D is part of the foundation for healthy aging. Vitamin D may be small, but its impact is enormous. It strengthens bones, energizes muscles, protects immunity, and even supports your mood. After 60, your body's ability to make and use vitamin D changes, but with a little awareness, you can easily stay in the healthy range. Ask your doctor to check your vitamin D level, spend a few mindful minutes in the sun, include fortified foods in your diet, and consider a supplement if needed. Remember, healthy aging is not about luck, it's about balance, knowledge, and action. And vitamin D is one bright spark on that journey. Materials are from my book, Essential Nutrients After 60. I hope you enjoyed the video. Thank you for watching.